Can you share with us how has your experience been working in this hospital?
See, that after have not only an orthopedic department of Sri Sathya Sai Institute of Higher Medical Sciences, where I had the privilege to work now in the Department of Orthoapedics. Even in the other departments I have witnessed in this Sathya Sai Institute has the type of equipment which is second to none that will be existent in any multinational hospital. Either in the materials make. Incidentally, I can tell you something. Then when Swami gave the blessing to start the orthopedic department, he told us, when you buy equipment, buy Indian made equipment whenever possible. He didn't say only Indian made, whenever possible. So he doesn't forget that also. But at the same time, he didn't want to reduce the quality of anything. Get the best. And whenever you can find the best locally, buy it locally. That's what he said. Anyway, the equipment, even in orthopedic department, about which I can vouch for, it can stand anywhere for testing or for comparison, and Sathya Sai Institute will come out in flying colors. So I can tell you a simple way the type of cases that we see in this Swami's Institute in our department, which is true for other departments also, like urology or ophthalmology or cardiothoracic. Extremely complicated, most difficult cases and even rare cases come here. That is the reason we have a full complement of postgraduate residents, D and B, because they get the maximum exposure not only in seeing and examining and getting exposure to the type of very rare cases, and also have hands-on training in such kind of cases, which is not available in most other institutions, including the teaching institutions. So even the material that's available, the clinical material that is available, is unmatched to this place when you compare to other places.
Sir, you worked with some of the best hospitals in the United States. How would you compare Sri Sathya Sai Institute of Higher Medical Sciences with them?
Absolutely no comparison. Because the reason why I say that is, everywhere else, unfortunately in today's environment, the medical care has become a commodity. It is not something which is noble or anything like that, the way that it is practiced. It is practiced for money. It has become a trade. So if you are poor, forget it. You cannot get top-class treatment in the world, in any other hospital. I can speak for hospitals in the United States where I practiced for more than 30 years. But that kind of thing is not possible. Whereas, if you come to Sathya Sai Institute of Higher Medical Sciences, either here in Puttaparthi or in Whitefield, or the Sathya Sai General Hospital in Whitefield or here, treatment is totally free, first come, first served. There is no favoritism based on caste, creed, religion, nationality, or anything. But whoever requires treatment will get the treatment, and not a penny is charged to any of them. And the training that we impart to our own students are not just the training in the medical aspects of alone, how to be a good doctor. You can be a very efficient doctor, but that doesn't mean you are a good doctor. The good doctor means you have to have compassion. Compassion along with your ability to handle any kind of illness. But without compassion, if you do only this, then you become a machine. Robotics are there today. Robotics can do what you and I can do as doctor, but they have no feelings. we should show our feelings to the patient. That is here in Sathya Sai Institute, Medical Sciences. And that is the major difference. And this has been vouched. We have had occasion to conduct various international conferences, several of them. I had the opportunity, with the blessings of Bhagawan, to bring top-notch people in the world who would like to be seen or heard by a lot of people. They have come here. And what they saw here, many of them called this place as a holy place. And they said they have never seen a place like this anywhere else. And they were in tears when they saw Swami. And they have told me they are ready to come any time we call them. And that is how it attracts people here.
Sir, what in your opinion you feel is unique to this hospital?
The unique to the hospital is very clear. How you deal with the patient who require compassion and love, first of all, and then proper medical treatment. And that is available in plenty here. The doctors treat them with compassion, and you can come and see them. We are not talking about this because we want to say this. Anybody who hears me saying this are welcome to come here and see for themselves what is going on here. It's not only the compassion and love besides the treatment. Anything and everything is totally free. I mentioned it before, I am mentioning it again now. The free means you are not, even if you are a millionaire, you are not required to pay anything here. If you are a pauper, you are not required to pay anything here. Millionaire and pauper are treated equally here. And none of them pay anything for the treatment, for the best treatment possible. And the treatment is not graded depending upon your status in society. So it is truly an equality in administering the compassionate care in Sathya Sai Hospital.
Sir, can you describe Swami as a doctor?
Plenty. See, it's very interesting, and this has happened in the veranda and outside. And one day Swami came out, we were sitting there, he started talking to us. And four of us, all from America. And he was talking to us, and he asked one of the guy, "Are you all healthy?" Then he mentioned that he has asthma. And Swami looked at him, created a chain for him, and just rubbed his chest like this, and then said, "You don't have asthma, you have eosinophilia." And he also gave an explanation. Do you know what is eosinophilia? Swami will ask the question also. And then he said, "Do you know the treatment for eosinophilia?" Then he said, "No, Swami." Then he mentioned the name, the medicine also, tetracycline. And then he said, even the dose. But that's not the dose normally a doctor will prescribe. But he said, you take this one tablet every day for 1 week. And then he also mentioned where this medicine should be obtained from. That is from the doctor whom I mentioned earlier, from Sathya Sai General Hospital. By his mere Swami has given him the blessing and the ability. You don't have to see the patient, you have to examine the patient, you touch him, he'll be cured. And Swami mentioned, get that medicine from that doctor and take it. So since he did not know where the hospital was, I went to him and got the medicine from him and gave it to him. Exactly 1 week later, we were standing on the line to go inside for darshan. He was standing in front of me. Then he said, "Doctor, I took the medicine the way that Swami said, 1 week. From day one, my wheezing is gone. It never came back." 2 years later, I happened to be talking to one of his colleagues. He told me he never had the wheezing again. Only Swami can cure this permanently. This is one such many instances. There are more instances too. And I mentioned about I'll tell you one other instance. Yes, there is one patient of Swami's own student, and he is still here in town. He had a very nasty motorbike accident. I believe it happened sometime in 2002 or 3. And as a result of this accident, he practically lost his entire leg. There's nothing left in the leg. It was not viable. So he was rushed to the hospital, and the doctors there wanted to remove his leg to save his life. And because he was Swami's student, Swami's permission had to be obtained. So Swami was asked. He said, no, do not remove the leg. So the doctor said no choice but not to remove the leg. So since Swami said that, naturally something good has to happen. So at a human level it cannot be cured or done or saved. So, but anyway, whatever was done for a long period of treatment, then he had something, an apology for a leg. He was not able to walk on it. He was using crutches or the wheelchair or something like that. A few years later, after the orthopedic department has started, then I was asked to see this patient. Then I went and saw him in his room. It was night, about 9:30 or 10. He was having very high fever, what we call as septicemia. That is a very severe infection in the bloodstream. He had to be admitted and put a rod in his leg, wanted to remove the rod as part of the treatment. And when I told him that, he said Swami will not give permission for that because the doctors previously had mentioned that. Swami has said no. So he won't give you permission, sir. He will not give permission. I said, all right, I will write the report. You take it to Swami and give it. Whatever Swami's will, then we'll do that. So I wrote a detailed report of his condition, what my recommended treatment is. Even with all this, the condition called chronic osteomyelitis, it is very difficult to cure this condition after so many years. And then I wrote it in the end of the report by saying, whatever we do, in spite of several surgeries, we may not be able to cure this condition. Only Swami can cure this. If Swami gives me permission and his blessings, I will operate. That's what I gave it. He gave it to Swami. Swami blessed him, materialized a ring to him. He said, go, have the rod removed, have the surgery done, come back to me walking, without crutches, without any support. And I did the surgery, and the way that we do this, I don't want to go through the details here, but I thought more surgeries will be needed. But Swami's grace, no further surgery was done. Everything healed beautifully. In the bone, which was not even half the thickness of his leg bone after all the dead bones were removed, which was just a slender stick, became so strong in both in volume and thickness and strength. Now, as Swami said, come back to me walking, he is running over everywhere, he is playing cricket. And there is no residual osteomyelitis. Then also he has shown in some instances that to win his grace, you don't have to be his devotee. Anybody can win his grace. And I had such an experience to witness that in a few instances. This was in 2003. I was here for an extended period of time. Because of certain situation here, I had to stay on for some time. And on the day just a week before I was to go back, my wife called me from USA. And she told me there's one of their family friends, their son, 38 years or something like that, who with a one young child, only child, who was 8 or 9 years old, and young wife. He was an officer in one of the major companies in United States, working in Kentucky, Louisville, Lexington area. He had a severe form of cancer called leukemia, and it's a deadly cancer. The patients usually, most of them die within 6 months, and we were very sad. Young man, the young child, and he was in the hospital for 6 weeks. The child could not even see the father because he was on chemotherapy. He was not allowed. He could not continue with the treatment of chemotherapy because he could not withstand the severe effects of the cancer killing medicine. So he was more or less given up to go. That's all. When my wife said that, I was feeling sad about it. I was mentioning to one of my colleagues, a doctor in Sathya General Hospital. And this was overheard by one of Swami's students who was here for a long time. He's employed somewhere else. On the day that I was leaving, just about a couple of hours before I was leaving, I was walking along the South Indian canteen, near the canteen. He came back after me and said, "Uncle, uncle, uncle." I stopped and he was there. He gave me a bag of vibhuti. And he said, "Uncle, you take this with you, give it to the person who your friend or relation who has cancer. This vibhuti is blessed by Swami." And I was stunned. But I didn't know whether they will take the vibhuti because they are not Swami's devotees, whether they will have faith in them or something. Her mother, their parents were in Madras, the neighbor to my wife's brother. I went there, I told the mother, "I have this vibhuti." It came to me, said, "Blessed by Swami." I didn't ask for it, they gave it to me. If you have faith in Swami and if you think your son will take it, you can have it. What do you want me to do with this? Then she said she will ask and find out, and she came back within a few minutes. He will take it. Will you please take it yourself and give it to him? Well, then took it and I gave it to him. He asked how to take it. I didn't know what to say. I simply said, take 1 teaspoon every day in honey or water or whatever. Amazingly, when even the cancer specialists, it is the University of Kentucky, Louisville, they gave up hope. And within 6 weeks, the count started coming back. And in 3 months, the counts came back to normal. And he was discharged from the hospital in 3 months. In 6 months, he was working part-time from home. And in 1 year, he started working full-time. Now, 2003 to 2015, he is very healthy, traveling all over the world. He has started his own business. No recurrence of cancer. Cancer is cancelled. He is not even Swami's devotee. Now his wife became a strong devotee of Swami, and now he too has started attending the Sai centers in USA.
Sir, any other experiences which you feel were life-changing?
Yes. See, this is the life-changing is already there. As being here itself is life-changing, watching what is happening, how Swami interacts with people, and how he sees the patient and treats the patient. One thing that was really appealing to me was coming from United States. So we always discharge the patient as soon as possible. We don't keep the patient in the hospital more than 1 day or 2 days. And here I saw patients who don't even need to stay in the hospital being kept in the hospital for 1 day, 2 days, 5 days, whatever. But we look in terms of dollar and cents, because every day that the patient is kept in the hospital costs money to the hospital. Then I was thinking, this is a free hospital, and why waste the resources by keeping this patient unnecessarily in the hospital? And the response for that I got was stunning. He said, Swami would prefer to keep the patients, even if they don't need to be staying in the hospital, as long as you can, because they are so poor, they cannot have a good food. Give them good food, give them a good bath, clean them up well, let them enjoy for a few days and then go. So this is another thing. And then interestingly, one last thing I'll say, that is, there is one little child. The child had a broken ankle, and I put a cast on that. Fracture has healed. 6 weeks later, we had to remove the cast. And usually the child are very they are difficult to control them, particularly when you want to remove the cast saw that we use, it's a motorized instrument and it makes hell of a noise. And it will scare even an adult, so not to speak of a child. So, and also if it keeps moving when we are trying to use the saw, the saw blade can cut the skin. There's a potential for that. So in order to avoid that, I use something like a tongue depressor or tongue blade inserted between the skin and the cast, so that the saw will not touch the skin, or the heat that is generated by the saw sawing through the cast material, that also will not affect the skin. Father came that morning at the appointed time with the child. Before coming to see me, the father has seen Swami, and he told Swami, they are going to remove the cast, Swami. And then Swami took a ruler and gave it to him. You take it with you and give it to the doctor. He may need it. How did he know I am looking for something like that? And that is the thing. He not only knows everything, he also knows when we need that and what we need it.
Sir, what in your opinion is the highest form of bhakti to Swami?
I used to think, before I got involved in this kind of things, bhakti means doing bhajans and going to temple every day and saying Rama, Krishna, Govinda and all those things. Keep on saying that, and that is bhakti. I used to think. That is not bhakti. That is superficial. So we may be saying all those things outside, but in the mind it may be something else. It may not be into God at all. So for that to happen, you must destroy the mind. Swami says, die mind. And once the mind is destroyed, then you can focus the whole thing on Swami. And when I mean focus everything on Swami means you should have no desire of your own. You should not think of yourself or your family, of your wealth or anything. You should have no feeling other than the thought of Swami only and nothing else. And that is total surrender. And that is what I call as bhakti, in my opinion, in my humble opinion.
Sir, what is your message and advice to the young doctors who are just starting their careers in medicine?
Yes, we try to give that message to all our postgraduates every time when they start here, because it's called what is called the ethics of medicine. So medicine has multiple facets. It is, first of all, knowledge. You must know what it is before you transmit your knowledge on something else. If you don't know what it is, then you are not going to do the proper thing. So that knowledge is first. So all of us have to learn, read, study, learn from experience of others, and that's a lot of things. In medicine, experience counts. Book knowledge alone is not enough. Swami always says bookish knowledge, bookish knowledge. Very true in medicine. Bookish knowledge is not enough. You may have won all the gold medals or all the medals and everything and that's available, but you may end up with a lousy doctor. So that is not what it is. But so what it is the knowledge is number one, and then number two, dealing with the patient and their families. You are dealing with feelings here. It's not another item. So that item has feelings too. And the people around that item, their relatives, have feeling. So when the patient is dying or in severe disease or they are going for a very major surgery, everybody is so worried about it. They may come and ask you questions. Be patient. Don't show irritation. Look at the patient, look at the relatives, look at the patient's face and talk to them. Answer their question with compassion. Answer every question. And also I tell them, another thing is, there are a lot of things in the news, unnecessary surgeries. So I tell all my students here, and that way I learnt also, always ask 3 questions. When you see a patient and when you want to do some surgery, the first question is whether that surgery is necessary. If you think that surgery is necessary, can you do that surgery yourself? Are you capable of doing it? And if the answer is yes, for that also there are more questions, then I will say that if it is your own father or mother or your wife or a child, will you do that surgery on that person, or will you have somebody else also, any other competent person to do the surgery on that person? And this is the last one. So if you have to say no to any one of these, do not touch the patient. So this I tell every one of them, and I try to practice it myself in my own practice. That is one thing. And then again repeatedly, which is the main thing of Sathya Sai Hospital, compassion, 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 love. So that is what it is.
Sir, you have been with Swami for the last 2 decades. How would you summarize this journey of yours with Swami?
I had the great fortune, it's a blessing, to come to Swami 2 decades ago. Every day has been so precious. My philosophy of life have changed for the better. But my approach to people also is different right now in this thing. And also looking at Swami, seeing him, watching him, listening to him, and all these things makes me a better person. And if I had not come to this, I'd have been the same old person that I have been for all my 60 years from my birth. So this is totally a different chapter in my life, for the better. And for that, I owe my gratitude with all my heart to Bhagawan Sri Sathya Sai Baba.